And welcome back to the Radio Vet with Dr. Kelly. So in my intro, I said success and failure in weeks. Do you guys measure things like that? Or is it more like, well, that one's getting better, that one's getting a little worse?
Do we measure it, like keep a tally somewhere on the wall?
Yeah, well... not in the lobby. Like, oh my gosh.
No, we don't. But we do share and talk about our cases together.
Okay.
And,
healthy.
the staff is generally informed whether, they just kind of know what's going on.
Sure.
So,
well, how many, techs do you have there? Like people who are just in for like 5 hours, 10 hours a week. Do you have
any part-time techs?
Yeah, part-time techs and stuff like that.
We have one gal who floats between being in charge of the kennel and is also a tech.
Okay.
So she would be the only one who's like part-time technician. Okay. Otherwise, we have, 4 full-time.
Nice. Now, do the techs, how much school? I mean, are they just people who, the lowest level is they love animals. Do they need any schooling for that, or can they just come in and?
So, certified veterinary technicians went through a 2-year schooling program and then had to take their exam,
like a certification thing.
Exactly.
Okay.
Yes,
Okay.
and then we have where I work. We currently have. Well, we do have one certified tech who works part-time on Fridays. She works full-time at another clinic.
Okay.
She's been helping.
Conflict of interest.
I know. She's been helping us out for over 10 years now. Wow. Ever since one of our full-time techs unexpectedly passed away a long time ago.
Okay.
Yeah, and so she just keeps coming because she likes working with us.
Yeah, great. No, that's all right.
So she is our one certified veterinary technician.
Okay.
The rest who we have right now are extremely experienced and extremely good, but they're
extremely uncertified.
They learned it all on the job, and they are veterinary assistants.
Very good. Okay. So, and that you can just come off the street and be like, I like dogs, I like cats.
Yeah, although it'll take a good 6 months to learn the job and, be able to reliably hit a vein when you want to draw blood, or
the assistants are actually kind of
intubate a cat. That's extremely difficult.
Wow, I couldn't.
do all the vaccine administration and medications and vaccines and help out in surgery.
Oh boy, so the veterinary assistants really are.
They get to do everything.
You're in there.
They get to do
down
everything.
and dirty.
Yeah.
All right. Well, yes. Let's not intubate a cat.
It's actually very difficult.
It sounds horrible. It sounds absolutely horrible. It'd be like trying to paint a cat's nails. Why would you do such a thing? But obviously, it has to be done.
Yes.
So
regularly.
Oh dear. So hey, what's going on over there?
So what do we see this week?
Yeah. Exactly.
So I have a lovely couple of clients who have a young Portuguese water dog.
Oh, sure.
And he is now, I believe, 3, and he's a very pleasant dog. And so about a year ago, they got another one from the same breeder. And he's a completely different story. And
they're like snowflakes.
So,
no two are the same.
Yeah, so the new one, the young one, he's just over a year now, so he's close to being an adult.
Sure.
His brain is still maturing for a little bit longer. He's probably done growing, but he is their ADD kind of child.
Oh my.
Completely different than the other one, who's really grown up and matured into a very pleasant young adult dog. And I feel badly because I can see that the younger one has inherited a tremendous amount of the working instincts of the Portuguese water dog.
Okay. Yeah.
And he's living as a pet, which means he's frustrated.
Yeah.
He's frustrated.
Don't you want me to carry those boxes up the stairs for you?
Yeah. So if the clients were interested in taking him through agility classes and going and doing that on a regular basis.
Sure.
Not, he would probably be a much happier dog and a lot less frustrating to live with.
Right.
But, they're retired, they're older, they're not interested. So they came to me a week ago, just to make sure, he doesn't have any medical problems that are related to all this crazy behavior. We did, some basic labs, including a thyroid hormone level, which sometimes is implicated in behavior problems. But of course, everything came back normal, just like we assumed it would.
The second question was, can you lobotomize him?
Well, yeah. And so they are, working directly with trainers.
Yeah.
They are learning, what to do when he does this, what to do when he does that. But I specifically asked them, do you want to keep him? Because he's living as a pet and he's frustrated, and honestly, he would do better in a different situation.
Right.
And they're dead set on keeping him. So.
Oh boy, that's interesting.
He stays a pet.
Those are big dogs, right? Those guys are.
They're not huge, but they're large breeds. They're over 50 pounds.
Yeah, that's large. I mean, it's. I heard a story this morning about a woman in Port who. Had a little mix-up with her very large dog. And, and I was like, there's a reason if you're over 60, you get a poodle. Because this was a big dog, like, Cujo type stuff. And, so and it was kind of a bad situation. And I'm like, oh man, So, what do you do?
It's really sad when you see that kind of mismatch between owner and breed that they picked.
I was brilliant because I got the most neurotic dog on the planet, and I'm the most neurotic human on the planet, so we're just like tight.
I didn't know you had a border collie.
No. Well, a rat terrier. So everything in the world is out to get him and kill him. And I totally
Are you kidding? He's supposed to be the one that's out to get everyone else and kill them.
It's interesting. Mice.
That's what rat terriers do.
Interesting. What have I done to him? That just living with me, he's taken on all of my traits, all of my fears. Oh my gosh, I've ruined him.
Yeah. So
he's not brave. He is not brave.
Speaking of border collies.
Here we go. What a segue. All right.
This is another breed that may and often does inherit very strong working instincts that are bred into the breed.
Corral. I must corral.
Yes. I must work. Yes.
Bless their little hearts.
I met a lovely 8-week-old one this week who's just beautiful, and she is owned by a family who's never had a dog.
Oh, no. This is like mismatch week for you then. Oh, dear. Why does he keep doing that stuff?
So I'm really not sure why they picked this breed, and I don't know what the breeder was thinking. He actually came from a sheep farm.
Oh, Lord.
So his parents...
Oh, my goodness. They better get some sheep.
And my quandary is, do I say something? Like, they've already had him a week. They're already somewhat emotionally attached, and they've started, of course, having fun because the puppy's only 8 weeks old. And when this dog gets to be 15, 16, 18 months old, all these new adult behaviors that are genetic are going to suddenly emerge, and it might be a disaster.
It's interesting. A relative of mine had a border collie, and they understood. For one thing, they lived kind of out on a farm. So, but they didn't have. They didn't have any animals. So they didn't have they just happened to live in a house.
But can be outside, away from the general public.
Exactly.
And get into trouble on its own without really causing real problems.
Without having Geico involved. But you're right. I mean, she was funny because she had to be out there doing something at all times. And it was funny because when she stopped doing something, she was the sweetest, very docile, chilled out, but that was between sessions of whatever the hell it was she was doing.
Right. And so in her mind, she was happy because she had a job. Whatever she was doing out there, it was her job, and that is what they desperately need.
I take it accounting won't foot the bill. So.
I'm really worried about this 4-person family who's never had a dog before getting this dog adequate outlets.
Maybe they can get ducks. I think you just sort of herd and corral the ducks.
Well, I think they're going to wind up spending a lot of money on daycare and classes, which is fine if they can do it and that makes the dog happy.
Sure.
Yeah.
I I suppose daycare is nice because then you can go and corral those dogs.
I know. And I did kind of sort of broach the subject about saying, well, someday when you have her and you have a party, she's going to try to herd the people and she might be a heel nipper because that's a normal part of herding.
Right. Exactly.
Oh.
Yep. I had 5 kids and there was plenty of heel nipping. No, I didn't do that.
So I feel bad. If it had only been the mom and not the mom and 2 kids who'd come to the first visit, I'd have said directly to her, you might, before you get any more attached to this dog, you should seriously consider if this is the right breed for a family pet, because you can tell I've already made up my mind it's not
down this road.
But that's only because of other ones I've seen, and everybody's an individual, so she should be, I shouldn't make that assumption because it's not 100% predictable.
Right.
But it's pretty predictable.
It's funny. My response was, "What, were all the golden retrievers sold out that week? Why did you go with this one?" Because golden retrievers are what families like yours need.
I don't know, and I partly blame the breeder.
Yeah, absolutely.
Because she should know better.
It's funny. We wound up at one time, and I think I mentioned this in the show before, with a golden doodle, and it just wasn't working out. And I could tell that this dog needed to be camping or kayaking or it's just our indoor lifestyle was not
very high energy dog.
Yes. Absolutely. And it was like, oh man, you could tell by week 3 that it was not going to gel with our lifestyle at all. And luckily we found a young couple who were like, we need a dog we can take camping and hiking. I was like, oh, have I got someone for you? And so we get updates like ones like quarterly, and it's always a picture of him with like a sombrero on, and he's in Mexico. He's living the life.
That's perfect when that works out.
Oh yeah, it was so very nice. Yeah, I was terrified that it wouldn't. I thought, oh, this poor, because he's a real sweet puppy, but just I'm like, oh no! I have to go to work. I can't be home watching this all day long.
Yeah.
So yeah, unlike my rat terrier, who is unconscious from 8 a.m. to 6 p.m., he just waits for me to come home. So,
that's good.
Yeah, he's a good boy. He's a very good boy. Yeah, and he's got cats to like stare at. He's got all those cats to look at and kind of stew over. He's like, ugh, what are they living here for? So he wrings his hands all day about them. It works out well. Any speaking of any cats in your rounds this week?
Yeah. So I saw a kitty who the owner brought her in because something didn't look right about one of her eyes, and she had been adopted from being a stray in the past few months. And at her first visit, everything's normal, looks really good, and then came back a month later. Something's really not right about one of those eyes. Yeah. There's a new, opaque, you can't see through it, deposit on the lower part of her cornea. And then if you look at the iris, the colored part of her eye, there's some bleeding going on.
Oh, geez. Okay.
Yeah. And so she has uveitis. That's inflammation inside the eye.
Okay.
And one of the most common causes in cats that we worry about is toxoplasmosis.
Sure.
It's a parasite. Yeah. So she's currently getting treated presumply for that, and we're going to see her again this week.
Do you expect her to potentially be de-eyed at one point? Is that because that happened to my boys?
Yeah. Only if it morphed into glaucoma.
Okay.
Yeah.
Okay. Because I am the king of the one-eyed cats, as you know.
If they suddenly don't want this one anymore when it only has one eye, I'll let you know.
I'm open 24/7, 365. I'm sure my kids would be overjoyed, of course. And it would be hilarious to have 3 one-eyed cats in the house. Yeah. I would just love that. I would just become this collector of like myopic cats. So.
You're like the Underground Railroad for one-eyed cats.
That's exactly right. We're here for you. All the corners are rounded. There's nothing.
Yeah, the convalescent home for one-eyed cats.
Right. Which is actually funny because we have my big boy Pete. He's his lack of depth perception is extremely noticeable because he's been known to actually think that the garbage can lid is closed and then throw himself away, jump into the garbage can. I'll just yell, Jamie, get the cat out of the garbage. Someone threw the cat away again.
Now, we have clinic cats that have perfect vision and do that.
So. Oh, really? Oh, okay. It's not
They actually just want to see what's in the garbage.
He's been known to miss, though. Yeah, right. Well, there's certainly that. I mean, he wasn't upset where he landed, that's for sure. But he tends to miss. Like, he'll jump for the couch and he'll miss by about a foot. So it's like, yeah, but he's fine. He's got a big keister, and he doesn't have any control over it, so he just knocks things over all day long. So now we don't set anything on anything anymore. All our surfaces are clean, so it's great.
Well, speaking of one-eyed pets.
Yes. I love all the segues we're getting in this week. We do this well.
I saw my patient who is in treatment for blastomycosis for a recheck this week. So he lost an eye after developing glaucoma that wasn't responding to treatment. We took out his eye. We discovered, he's got blastomycosis, a terrible fungal infection in his eye. And then we took chest x-rays. It's in his lungs.
Oh, yeah.
He's been on his fluconazole now for 3 months.
Okay.
And he his chest is perfectly clear.
Nice.
Yay.
Success.
And so we're rechecking his blastomycosis level.
Okay.
And then once that gets to 0, we'll do 1 more month of therapy beyond that before we stop.
That's great.
And hopefully he will be cured.
It doesn't always go this way, though, does it?
No, it doesn't always go this way.
Is it a 50-50 or a 60-40? How does that?
He's doing very well. He's gonna be fine.
Oh, I mean, just overall. What's the kind of survival rate?
If you take if you've got a sick dog and you take a chest X-ray and the blastomycosis spots are all through all lung fields,
sure,
that prognosis is far lower than if he's just got glaucoma and a few spots in his lungs like this dog's. So
like so much in life, early detection is key.
True. Yeah, true. But they all can present differently. Some dogs with blastomycosis present with a non-healing skin wound. It just keeps oozing and oozing, and it won't get better and won't get better and won't get better. And you look at some of the ooze under the microscope and you see the blastomycosis. So they can show up in different ways.
And again, this is one that they get from schnarfing around in water.
The soil around water is where it lives. So you can inhale it, or you can have it get into you through a puncture wound in the skin.
Okay. Yeah. So camping dogs and hiking dogs and stuff like that. Yeah. Huh.
So let's see. Another dog I saw this week, he has a history of biting, unfortunately.
Oh, no.
Yeah, and it's gotten worse.
Anger management issues.
Exactly, yeah. His biting is not always predictable, and he was a secondhand dog, and I think they kind of knew about it, when they got him, found out about it shortly after getting him. They've had him for, at least 2 years.
What breed?
He would be some kind of mix. I'm going to say a corgi mix.
Oh, no. A cute one.
Yeah, he's got a massive underbite.
I love those.
His lower teeth are extremely visible.
Oh, my.
Anyways, his biting has been getting worse in recent months now, to the point that Mr. had to go get stitches.
Oh, boy.
Yeah.
Oh, boy. Is this a family dog, like kids and
Yes. Yes, exactly. Everyone's been bit a few times, but this bite was worse.
Oh, geez.
Because Mr. had to go to a walk-in clinic or
and I wonder
ER and get stitches, which means
it's unprovoked, right? I mean, it's just like, it just happens, huh?
Sometimes it really sounds like that. If they have someone come over and he's all la 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 la, someone's here, and then he settles down. But then as soon as they get up and walk across the room, he'll run over and bite them.
Oh, good heavens.
Yeah.
No,
that's
tough.
So at any rate, he had to go through a rabies quarantine because when a person has a bite and they go to the doctor, it has to get reported.
Right,
and the dog has to go through a 10-day rabies quarantine because rabies is still considered uniformly fatal for humans, even though a tiny, tiny, tiny number of people have managed to survive it.
Sure.
And we decide, after many discussions and tears, we decided that we all agreed that he had crossed a line and that he wasn't a safe pet for anyone. And we said goodbye to him at his last visit.
Okay.
Yeah,
okay.
So
wow.
He's gone.
Was he pretty young or
middle-aged?
Middle-aged. Okay.
Yeah, middle-aged.
Yeah, that's tough. I mean, what do you do with that? It's
You can either pass the problem on to someone else and someone else will get bit.
Yeah.
Or you can, go find the mythical farm where all difficult dogs go to live out their days in happiness. I have yet to find it. I've yet to have a client find it.
I have a feeling like Santa Claus and the Easter Bunny.
Yeah.
It may not exist. Just,
Who wants a biting dog? Anyone?
Right.
Sign up, please.
At that point, you don't charge them; they charge you. You're like, okay, you can pay. I'll take your dog, and you pay me $150.
So the difficult reality of euthanizing a truly unpredictably aggressive / dangerous dog.
Yeah,
it's sad because 98% of the time it's a good pet.
Right.
It's that 1 or 2% that truly makes the difference.
Well, if they're breaking the skin and causing stitches,
it's getting worse.
Yeah,
it's getting worse.
Absolutely.
So he unfortunately is one that I just say he wasn't wired right from the beginning.
Yeah, had something in his past possibly too. You don't know. It's not like a car where you can do a Carfax on them and see what their past is like. I mean, if they had a bad owner and someone was
and we all know,
it's
not the dog's fault,
right?
But that doesn't mean that we can live with it,
right? Right, absolutely. Yeah, I had we had a cat story like that. This one cat who he wasn't actually overly friendly, but he was fine. But then he would just have these moments where he would just freak out and attack humans. I mean, and it wasn't mine. I was actually watching him for a friend, but he came over and he ripped my leg apart.
Yikes.
I mean, it was bad. It was a bad scene, and I felt bad because I was like, well, I gotta tell him, and he was like, yeah, so we took him to the. Well, I'm taking the Humane Society actually, and they were like, They told us a few days later. They're like, this is not working. This cat has got he's got a history. There's
something's wrong.
Something's deeply wrong, and I knew what the next steps were going to be, but we were kind of devastated for a few days. I was like, oh, geez. I mean, I don't know. It's not easy, easy at all. But those hard decisions, I guess, are why we have people like you, Dr. Kelly, to help guide us to the
inevitable.
The inevitable, or at least the decision that feels right, so that's a good thing. So
it was sad, but it was, we all kind of came to the agreement that, this is just what has to happen.
I guess if I were that mom and dad, I'd be like, all right, let's go shop for a puppy. Right. we can craft and groom from day one. So there we go,
So on a sort of happier note.
We'll take it.
I have a lovely 4-year-old large breed kind of German Shepherd maybe mix who we love to see, and her owner, a nice young lady, brought her in because they thought maybe she was having dental problems because there were some swellings at the back of her jaw. And she just wasn't feeling good. She wasn't eating as much, and she didn't have as much energy.
Yeah.
And, when I saw her, she definitely had a fever, which would make her appetite go way down.
Certainly, yeah.
And these swellings at the back of her jaw were her lymph nodes. And all of her lymph nodes externally were swollen. All 5-8 pairs that I can feel on the outside of the body are all swollen. So I took some samples with a needle from several of the lymph nodes and sent them to the lab, and it did come back lymphosarcoma.
Oh, boy.
Yeah, but she, being a young, very wonderful, pleasant dog, is going to go through chemotherapy.
Oh, my goodness.
She will have an excellent chance of going into remission.
Okay.
And dogs who go through chemotherapy, the goal is to get them into remission, not to be so aggressive that we, make them sick but get to a cure.
Sure.
Meaning they don't get sick.
Yeah.
Okay.
Yeah,
they don't lose their hair. They don't spend days vomiting or feeling horrible after their treatments. But they do have an excellent chance of remission, and so I think she'll do great.
How long does that round go then? Like a couple months, or how long?
Yeah, 12 weeks.
12 weeks. Okay.
Yeah, 12 weeks.
Okay. Mm-hmm. Is that and it's a once a week type of thing? You take them in?
It's a once a week type of thing. Okay. Although there are some weeks where it's only a recheck blood work, but no actual drug.
Gotcha.
Yeah.
Okay.
So, but chances are she'll do great.
Well, fantastic.
And she'll have some more time, and she'll feel better.
Yeah.
Because she will have fewer live cancer cells in her body, which means she'll feel better.
Yeah, absolutely.
So yeah, she'll probably do great.
Huh. How many years can you expect after that then? I mean,
How many years?
Yeah, I mean, is it a full life or is it maybe just
No, it's not a full life.
Okay.
It'll most likely come back at some point and then may or may not respond to a second round.
Gotcha.
So if she goes into remission, we would hope that she would get like another 1.5 or 2 years.
Gotcha.
Yeah.
Okay.
That'd be fantastic.
Yes.
It's kind of cool, just a little brag, but the best and most commonly used chemotherapy protocol for dogs with lymphosarcoma is called the Madison Protocol.
Hey, all right. Go Big Red. Bucky all the way.
Yeah.
We'll have to start doing stomp around in here and shake the whole library.
Yeah.
So, all right. Well, Dr. Kelly, thank you for coming by. I feel caught up.
Yes.
You're
all
like
caught up on my
in the
patients
know.
now.
All right, fantastic. We expect you back here next week.
Yes.
For more of the same. All right, it's the Radio Vet with Dr. Kelly on CPO Radio, and we are also available, of course, the show on all of your favorite streaming and podcast platforms. And also look for Dr. Kelly visiting the Jack Henke Show once a week, Thursday mornings around 8:30. Not that she would admit that. She cringes every time I mention that she's on the Jack Henke Show.
You weren't going to say anything.
Sorry. Once a year I got to. All right. Take care, everybody.